Hello, and welcome to the Volunteer Action Network webinar training about medical aid in dying. We'll start with a brief overview about Compassionate Choices, the Volunteer Action Network, and what you can expect to get out of this training. Compassionate Choices is the nation's oldest, largest, and most active nonprofit organization working to improve care and expand options for the end of life. Compassionate Choices believes in patient-centered care. We believe that every person should receive medical treatment that is aligned with her or his values and priorities, and we believe that people and families should be fully informed and supported by providers on the full range of end-of-life options, including medical aid in dying. And I would like to emphasize that volunteers like you are truly the key to our success. Compassionate Choices National Volunteer Program created the Volunteer Action Network to engage our volunteers in focused topics. The Volunteer Action Network provides timely resources and materials to volunteers so that you can make the best use of your time and energy on behalf of Compassionate Choices. The Volunteer Action Network has prioritized 5 main action areas, or tracks. They include medical aid in dying, which you'll learn more about during this presentation, Compassionate Choices Federal Policy Program, which is a roadmap for work we do at the federal level to achieve patient-centered, family-oriented end-of-life care that empowers individuals and honors their choices. Public Speaking and Storytelling, which relies upon a network of speakers and storytellers across the country to help educate and empower people seeking the best possible health care. Truth in Treatment, which is a consumer-driven initiative that will provide support and tools to help patients with advanced illnesses build trusting relationships with their doctors, ask better questions, and make fully informed treatment decisions. And the Access Campaign, which is how we implement medical aid in dying once it has become authorized within a state. Each track has its own dedicated training materials, like this webinar, along with specific actions that you can take as a volunteer to further our work in that particular area. This webinar training will provide you with an overview of medical aid in dying, which will give you the context and information you need to begin volunteer work in this track. It is meant to be used in conjunction with the program handbook for medical aid in dying, which you can find on the Volunteer Resource Center page of the Compassionate Choices website. Additionally, there are fact sheets on medical aid in dying that will provide you more information. Keep in mind that all volunteers working on medical aid in dying issues must watch this webinar and review and become familiar with the Medical Aid in Dying Program Handbook before beginning work. This will make sure that you, our ambassadors in the community, have a consistent understanding of Compassionate Choices positions and can speak to the issues surrounding medical aid in dying knowledgeably. Before we get any further, let's review the objectives of this session so that you can keep an eye on the big picture, even while you're learning some of the details of our policies and work in this program area. By the end of this training, you'll understand why adults with a terminal illness should be able to choose medical aid in dying among their full range of end-of-life options. You'll be knowledgeable about Compassionate Choices' work to pass medical aid in dying laws. You'll also be knowledgeable about medical aid in dying laws in general. And you'll understand how you can support our medical aid in dying advocacy work as a volunteer. Finally, you'll be ready to take action in support of our work to expand access to medical aid in dying. We've seen that end-of-life healthcare has changed. The good news is that technology has advanced. We've learned to cure more illnesses, and people are living longer lives. But we're also seeing a downside to these technological advances, which is resulting in unnecessary suffering for many people at the end of their lives. More than 80% of patients with chronic diseases say they want to avoid hospitalization and intensive care when they're dying, yet only 25% actually die at home. Further, 30% of patients spend their last 10 days of life in the intensive care unit, and the number of patients who experience pain and suffering at the end of their lives increased by 12% between 1998 and 2010. So, what's the alternative? What would a peaceful death look like? When asked that question, Most people will say that it includes being at home with loved ones, having their pain and discomfort managed, having their spiritual needs and values respected, and not being a devastating burden on loved ones. Tragically, Jennifer Glass, a medical aid and dying advocate in California who had terminal cancer, did not experience a peaceful death. She suffered a drawn-out and painful dying process just months before the law was enacted in California. As she stated in her testimony to California lawmakers when the California Aid in Dying law was passed, "I'm doing everything I can to extend my life, but no one has the right to prolong my death." So what is medical aid in dying? Also known as death with dignity, medical aid in dying is a safe and trusted medical practice in which a terminally ill, mentally capable adult with a prognosis of 6 months or less to live may request from his or her doctor a prescription for medication which she or he can choose to self-ingest to bring about a peaceful death. In Oregon, where the medical aid in dying law has been in effect for nearly 20 years, there have not been any instances of abuse of the law, and studies have shown that end-of-life in care has actually improved in dramatic and measurable ways. Oregon has one of the highest utilization rates of hospice care in the country. More people die in their homes in Oregon than in any other state in the country, and terminally ill people report a great palliative effect that relieves worry and anxiety at simply having the option available to them if they need it. Bioethicist Arthur Kaplan said, "The Oregon law has benefited many more people than have actually used it." Although each state's regulatory and procedural requirements differ slightly, all mandate eligibility criteria, including a terminal diagnosis and prognosis of 6 months or less to live, as confirmed by 2 physicians. They also require that a person be decisionally capable and an adult. Medical aid in dying has evolved into an accepted practice with well-established protocols for physicians. The Journal of Palliative Medicine published clinical criteria for medical aid in dying that physicians use to ensure that the practice meets the highest standards of medical care. Accordingly, all of the medical aid in dying laws in the United States include core safeguards, such as required education on other end-of-life options, including methods for pain control and hospice care, and the right to rescind the medical aid in dying request at any time. The terminally ill person also must be able to self-administer the medication. In addition to being safe and trusted by doctors and communities, medical aid in dying is a compassionate and palliative medical practice. There has not been a single incidence of abuse or coercion in the nearly 20 years that Oregon has authorized medical aid in dying, or in the 30-plus combined years of medical aid in dying in all of the authorized states. The core safeguards are proven, and the law works as intended. Only terminally ill people who are mentally capable of making their own healthcare decisions are able to voluntarily ask for a prescription to take if their suffering becomes unbearable. The attending physician is required to inform the terminally ill person requesting a prescription for medical aid in dying about all their end-of-life care options, including hospice care, palliative care, and pain control. The terminally ill person must be free from undue influence or coercion. 2 doctors and 2 witnesses must sign a form attesting to the voluntary nature of the request. And the individual always has the right to rescind his or her request or not take the prescription at any time. It is completely voluntary. What's more, participation for physicians, pharmacists, and healthcare providers in this law is voluntary, with the option of opting out. For clarification, and I do want to be clear on this, medical aid in dying is not the same as suicide or euthanasia. Suicide involves people who are severely depressed and no longer want to live. People who seek medical aid in dying are suffering life-ending illnesses and understand that their condition is no longer treatable. There is no hope for a better outcome, Those considering suicide see no hope and do not recognize that their problems are treatable. These people request medical aid in dying not out of despair or depression, but to maintain some dignity and comfort in their final days, to ease their pain and suffering, and to help them experience a peaceful death. According to the American Psychological Association, aid in dying and suicide have, quote, profound psychological differences. Further, factually, legally, and medically speaking, it is inaccurate to equate medical aid in dying with assisted suicide. The Oregon, Washington, Vermont, California, Colorado, and D.C. laws emphasize that actions taken in according with the Act shall not, for any purpose, constitute suicide, assisted suicide, mercy killing, or homicide under the law. This is because a person who is choosing medical aid in dying already has a terminal prognosis of 6 months or less to live. They are not choosing to die. The disease is taking their life. The terminally ill person who chooses medical aid in dying is simply choosing not to prolong a difficult and painful dying process. Assisting a suicide remains a felony in states where medical aid in dying is authorized. So saying assisted suicide uses the language of a crime to describe a medical practice. The American Medical Association defines euthanasia as the administration of a lethal agent by another person to a patient for the purpose of relieving the patient's intolerable and incurable suffering. Medical aid in dying is fundamentally distinct from euthanasia, because in the act of euthanasia, the physician, not the dying person, chooses and acts to cause the death of the patient. Euthanasia is illegal throughout the United States. Medical aid in dying requires that the patient self-administer the medication and therefore always remains in control. Accurate terminology for the medical practice includes medical aid in dying, death with dignity, named after the Oregon law, and end-of-life option, named after the California law. Miguel Carrasquillo is Compassion and Choice's first terminally ill Latino advocate. Inspired by Brittany Menard, and as part of his advocacy, he recorded videos in both English and Spanish urging legislators in the United States and in territories to pass medical aid in dying bills. He asked for others to be allowed to forego the suffering he had to endure. Miguel became a voice for Latinos, a community he loved and fought for until his last breath. Miguelito spoke with pride as he referred to himself as the Latino Brittany Menard. Menard was also a young, terminally ill person with brain cancer, whose advocacy inspired California to pass medical aid in dying legislation after she moved from her home there to Oregon in 2014 to utilize its death with dignity law. So why are we doing this? Medical aid in dying is broadly supported by most Americans. Every major poll shows that even though medical aid in dying is not yet authorized in all states, it enjoys broad support across the country. In fact, evidence is clear that medical aid in dying commands long-term, bipartisan majority support among Americans. Independent pollsters such as Harris, Gallup, and Pew all put support for medical aid in dying somewhere between 65% and 75% nationwide. Further, according to a Medscape survey of physicians conducted in 2016, 57% of American doctors say that medical aid in dying should be allowed. Independent state surveys of states as diverse as California, Hawaii, Maryland, Minnesota, New York, Tennessee, and Colorado also demonstrate broad support for the practice. And this state-by-state polling also indicates majority support across demographic groups. For example, approximately 3/4 of Californians and Hawaiians support the practice. Similarly, 77% of New York State voters support medical aid in dying, and clear majorities extend across lines based on respondents' religious affiliation, level of education, political party enrollment, gender, age, and region of the state. And a Tennessee poll showed that Tennessee voters agreed by a 17% margin, so that's 55% versus 38%, that doctors should be permitted to assist people with painful, incurable diseases to painlessly end their lives. What's more, nearly 2/3 of Tennessee voters, 65%, supported some sort of option for ending one's life due to health concerns. And this broad support extends to state medical professional associations for licensed physicians. 65% of current members of MedChi, the Maryland State Medical Society, said the society should drop its opposition to medical aid in dying. Additionally, after reviewing the California End-of-Life Option Act, the California Medical Association, which is the state's largest medical association, removed its opposition to medical aid in dying legislation. In a historic press release, they said, "We believe it is up to the individual physician and their patient to decide voluntarily whether the End-of-Life Option Act is something in which they wish to engage. Protecting that physician-patient relationship is essential." Other medical organizations are similarly supportive. The American Public Health Association, the American College of Legal Medicine, the American Medical Women's Association, and the American Medical Student Association support open access to medical aid in dying. Compassion and Choices is working with state medical associations and other groups across the country to expand support for and access to medical aid in dying. Medical aid in dying is currently authorized in a number of jurisdictions, either through legislation, ballot initiative, or court decision. As you can see on this map, Oregon was authorized in 1997 by ballot initiative. Washington was authorized in 2008, also by ballot initiative. Just 1 year later, Montana authorized medical aid in dying by court ruling. And Vermont, in 2013, became the first state to authorize the practice through legislation. California was just 2 years behind. In 2015, they also authorized medical aid in dying through legislation. And Colorado authorized medical aid in dying in 2016 through a ballot initiative, and just months later, the Washington, D.C. City Council and Mayor voted and approved a law that was enacted in February of 2017. Compassion and Choices is actively pursuing a capacity-building model as we work to extend end-of-life options in all 50 states. Accordingly, we've grouped our work across the 50 states into 4 categories, which are implementation states, where medical aid in dying is already authorized and we are working to expand access; campaign states, which are ripe for victory; action states, where there's a solid base and strong volunteer support, and which are generally expected to introduce medical aid in dying legislation; and growth states, where there's a limited base of support and where legislation may or may not be introduced. Compassion and Choices supports all of its volunteers with a full suite of materials and resources because we know your work is crucial to our success. If you've signed up to volunteer with Compassion and Choices, you should already have received the most recent quarterly action bulletin via email. You can also find current and previous quarterly action bulletins in the Volunteer Resource Center on the Compassion and Choices website. Quarterly action bulletins represent the organization's highest current priorities for volunteer efforts and give you specific actions that you can take to make an impact in each of the program tracks that were reviewed earlier in this presentation. Once you've completed this training, please review the quarterly action bulletin again. Each of the actions belongs to one of the program tracks. Look for actions that are marked Medical Aid in Dying under the program track heading and get to work. Beyond the website, another great resource for you is the Volunteer Brown Bag series. On the first Wednesday of every month at 12 p.m. Pacific Time, 3 p.m. Eastern Time, the National Volunteer Program holds a free educational conference call for volunteers that features leaders in the end-of-life care movement talking about important and timely topics. Please join us live for future brown bag presentations. And if you would like to hear past brown bags, visit the Volunteer Brown Bag Archives on Compassion and Choices Volunteer Resource Center webpage. Just scroll down towards the bottom where it says Volunteer Brown Bag Archives. If you're interested in working on actions in the other program tracks, please complete the video training presentations and review the program handbooks for those tracks prior to beginning any work. You can find all of these resources and others on the Compassion and Choices website on your screen. We close our training with a reminder of the power of individual advocacy. Brittany Menard's remarkable story has drawn millions of people to the movement to expand end-of-life options nationwide. Her courage has inspired many to share their own personal stories and moved countless people to action. And now you're ready for your next steps. Review the Medical Aid in Dying Handbook and related fact sheets. Refer to the most recent issue of the Quarterly Action Bulletin and take any actions that are listed under Medical Aid in Dying. If you're part of a local action team, let your team leader know you've completed this training and get involved in your action team's medical aid in dying advocacy activities. If you're interested in working on actions in the other program tracks, please complete the video training presentations and review the program handbooks for those tracks prior to beginning any work. We're so grateful that you've stepped forward to volunteer for Compassion and Choices and that you've chosen to work on the medical aid in dying track. Welcome and thank you. You are now part of the movement too.